My name is Clifton Campbell. I'm an addictions counselor for Medicine Hat. With health sciences, I've been in a variety of positions. I'm currently acting steward at our worksite, and with the Alberta Federation of Labour, I'm the president of the Medicine Hat District Labour Council. Because I wanted to help people. Really, really important. I wanted to help people. I wanted to make a difference in people's lives. And in the addictions counseling profession, there are all sorts of opportunities to make a difference in people's lives. With our union, all of our healthcare professionals definitely make a difference in people's lives, and they made a difference in mine and my family's life, and that happens each and every day in healthcare. When I first got started with HSAA, I was part of the transitioning committee as we did transition bargaining from ADAC, the Alberta Alcohol and Drug Abuse Commission. We became part of Alberta Health Services, Addictions and Mental Health, and as we transitioned, HSAA was the union that accepted us and we became part of. So it was out of curiosity that I first became part of HSAA. I didn't really know what unions did. As time has progressed with my union, curiosity switched from need and necessity to what the union does aligns with my values, and that's why I continue to do it and remain active to this day. Yeah, that's something that I've learned over time is our connection with HSAA to the larger labor movement as a whole. And one thing that's really important is we can't just work in a silo. And if we're working in a silo, we're not going to be as powerful. So when we're able to connect with other unions, with other workers, and to really advocate for benefits for everybody, it makes us that much stronger. So continuing to connect and have opportunities to advocate for benefits across the province, across the country, is something that can only be done if we connect with others. And to me, that's what unionization is all about, is not working alone and connecting with others and having the largest voice possible to make change happen. That's one of the things I enjoy most is when we get a new hire or somebody who's just joining our worksite is educating them about the benefits of the union. So my advice to give them is to sign up right away and to learn all you can, because these things do matter. One thing that I have heard said is that precarious work is a psychological injury. Many of our young hires, new hires, are in temporary positions or casual positions. And if they don't have the support or know that there's benefits attached to being part of a union, it can lead to some disconnection and conflict in the workplace. But when they can start to see benefits and feel like they're included and part of something, they're going to be the voice of the labor movement moving forward. So it's really important to include them. I just had a colleague recently who came on board and signed up and has since joined one of our provincial committees, and she's really liking it as a young worker rep, and that's been one of the highlights of my time in HSAA and in my career. I would like to see it grow. I would like to see union density grow. I would like to see more members. I would like to see more people out at meetings. Another vision that I have for HSAA is to continue to make gains in regards to having healthcare available for everybody at all times. That includes pharmacare, a dental plan for everybody. I think it's really, really important that we continue to advocate and protect human rights so that when we see people's rights being eroded, that we don't just tolerate that and sit back and watch it happen, whether it be with our LGBT communities or women's right to choose. Those types of things, they need people advocating for those things. And if we just sit silent, things are going to happen in this world that aren't good for anybody. So I want to see HSA continue to make gains in those directions.